is Daisy Jo, and I am here to explain the Health Insurance Portability and Accountability Act. Regards to American Sign Language interpreters. Throughout this video, the Health Insurance Portability and Accountability Act will be referred back to its acronym, HIPPA. HIPPA came into law in 1996. It's a federal law that governs the use and disclosure of identifiable health information. Consumers or patients. In the end, meaning that people who work for a hospital or clinic, such as doctors, nurses, and interpreters, etc., cannot share personal identifiable information of a consumer or a patient. Interpreters are required to follow HIPAA because we are business associates and members of the workforce. As our job, we are required to facilitate the communication of language and culture, within appointments. During these appointments, personal information is being shared. In the end, personal information that we obtain as interpreters cannot be shared with anybody outside this appointment. The only possible way that interpreters can share information is through written authorization from the consumer or the consumer's personal representative. Information that must be protected includes the name of the patients, date relating to the parties, such as the date of birth, day of death, dates of medical treatment, admission to the hospital, discharge from the hospital, contact information such as telephone numbers, addresses, emails, fax numbers, social security numbers, medical records, photographs, anything that can uniquely identify information regarding a consumer or a patient. There's two misconceptions about interpreters and HIPAA. Those are the appointment books and schedules that interpreters obtain, and interpreters leaving messages for these patients. Interpreters leaving messages for these patients. First off, interpreters are allowed to have appointment books and schedules that can keep the patient's name, phone numbers, medical record number, date of birth, the physician's name, any information that's needed for the appointment. Because we are ethical business practices, we are required to keep this information confidential and not share this with anybody else. We are the only ones that can have access to this information. In addition, interpreters that are required to leave a message for consumers or patients can leave a message regarding their health from the doctor. Except if there's a restriction that is held, that we cannot share this information. The only way that we can break HIPAA is if an emergency has occurred and that detrimental aid is needed for your health. In the end, we won't want to do any harm and share information. Therefore, we will follow HIPAA and keep your information confidential. Hi, my name is Daisy Jo, and I am here to explain the health insurance portability and accountability